I think with regards to dementia patients, we're not always using the term palliative care when we apply care, and it's maybe neither here nor there, but I think a lot of people in this work have really been doing good palliative care for quite some time. We just might not recognize it as such. So I think that it's there. I think the quality of good care is there on one hand. But I'm also going to be realistic and really share that I've seen and I've heard and in my experiences with individuals impacted by this disease, as the disease begins to progress, and as individuals have less and less ability to verbalize their needs. I think the ability for even good family members and healthcare workers to really apply a palliative care model or a person-centered model begins to diminish just a bit. I've seen and I've heard too many situations where people who have the later stages of dementia suffer more, they're more isolated, they're more lonely, they're not receiving good care, they have more bed sores. And partially, I think a lot of that is because, without the ability to verbally tell somebody that I'm in pain, we have to look for other methods to do that. I think that people living with dementia communicate what they need in a lot of different ways. And part of what I think we're doing in the United States, and I know a lot of other countries are as well, is really beginning to fine-tune how we care for individuals living with this disease by seeing other ways of understanding communication as the disease progresses. Because I think we do have, and I think one of the things that this particular conference really highlighted is the recognition that as people go into the later stages of a terminal illness, so much of what they need is so much of what we actually can provide. And it's not a hopeless, devastating, and it can actually be an experience that can be lovely, but we really have, I think in order to make that happen, we have to really have a way of thinking about caring for somebody and apply that. And one common theme that I heard was the ability to really listen. And I think that, as simple as it sounds, is a really impactful and profound message. Because people living with dementia, even in the later stages, communicate. It might mean that our presence needs to be more impactful, but also even listening to the whole family system, who probably knows a person living with dementia better than anybody else. So I think one of the main things that everybody needs, whether you have dementia, whether you're a care person of somebody living with dementia, is there's such a therapeutic quality to stepping back and to just sharing and being part of somebody's space.